this you go to the grocery store and instead of pushing the cart, you're leaning on it as you go through the store, then you might want to get to know our next guest. Dr. Mushari and Dr. Church from Arizona Pain are here. Good morning, gentlemen. Thanks for joining us. You know, those people suffering from pain and they can't walk a long time, they need a break, they need to lean on something. There's a treatment that you two gentlemen are doing called mild. Doctor, what does that mean and what is this treatment?
Good morning. So mild stands for minimally invasive lumbar decompression. And in plain English, it's basically roto-rootering the bones around the spinal cord to kind of create an opening in that space so that the spine can move freely and the nerves are freed up. And so how it's performed is kind of very similar technique to what we use when we do epidural for like a woman in labor. Very similar technique. And essentially, we just place a small instrument next to the bones in that area and just kind of clean out the bone area around the spinal cord to open up space and allow the nerves to breathe freely, essentially. And what that allows is for patients they experience almost immediate relief of pain and symptoms and can stand up straight and can now walk for prolonged periods of time. So it's pretty amazing.
So tell me more about the procedure. Is it a long procedure? When do they start feeling the results? And I guess, who would be a good candidate for it?
Sure. Yeah, it's a minimally invasive procedure. And it does not take a significant amount of time to do. It's not as invasive as major back surgery. And most commonly, patients really they go home same day with a Band-Aid on their back. The recovery time is about 24 hours. And then they're back on their feet and living their life. So we see amazing results, and it's specifically geared towards patients that have been told that they have spinal stenosis, or as you described earlier, patients that can't stand up straight, or have to lean on a shopping cart when they're going shopping, or can't walk for prolonged periods of time, or are using walkers because they don't have good balance or can't walk on their own.
Wow, and with mild, I'm curious because so many people suffer from back pain. Do you have a procedure and do they need any follow-up after that? Or how long does the treatment last?
Well, it's actually permanent. It lasts.
Wow.
It lasts for a long time.
Yes.
So essentially how the procedure works is we're just removing extra tissue around the spinal cord. So once we remove it, it doesn't grow back. So for the patients who qualify and who are good candidates for this, it's a permanent treatment.
Yeah, it's a life-changing treatment.
Absolutely.
I think for a lot of people. Dr. Church, you see these patients in your office. Tell me the benefit of this mild procedure and why it's better than some of the other procedures people may have heard about.
Yep, thank you. It's really exciting to see these patients who have these symptoms that we've described. And traditionally, in the past, they would go see a spine surgeon and have a major spine surgery. But they don't need to do that anymore. They can come in, get evaluated, and have this procedure if it's going to benefit them, and their recovery is 24 hours.
And what are some of the comments, reactions you're getting from your patients after they've undergone this?
Well, we've had lots of patients that, they're able to walk longer, stand longer, play with their grandkids, go on walks with their spouses or their loved ones, with their dogs, and really get back to activities that they want to do but haven't been able to because of this problem.
So this really is helping to improve their quality of life.
Right, and we know what's amazing too is that it's covered by insurance. So there's really no reason why patients should not be informed about this or not have this as an option.
And for patients out there, our viewers, that a lot of people are going through this and they've tried everything, what would you recommend?
Well, I think they should really come into Arizona Pain and be evaluated and see if they're good candidates and see how we can help them.
All right, gentlemen, thank you so much for coming in and sharing your knowledge with us. We appreciate it. And if you want more information about everything we just talked about, all you have to do is head to their website or call that number you see right there on your screen.